Families struggle with how to know whether or not a kid in the family has a problem, because many of the signs and symptoms of substance abuse look like the signs and symptoms of being a teenager. Substance abuse typically coexists with other problems. There might be an educational problem that is fed by or created by the substance abuse. There might be a mental health challenge. There might be any number of other issues as well. Those problems most likely are going to continue to get worse because they're fed by the substance abuse problem as well. But the biggest sign and symptom of a serious substance abuse problem is consequences. A lot of kids in their adolescent years, the sad truth is, will try drugs. Most kids, when they encounter the consequences that are created when they do, either something as mild as a hangover or a feeling bad the next morning, or something more serious like a driving while intoxicated or something like that, most kids will stop. They'll connect the dots that behavior causes that consequence, and they'll stop. We're talking about kids that we treat who continue to use in spite of consequences that stop most other people. Our primary treatment model for adolescents is called the Roadmap to Recovery. We want to really, really, really get to know this kid. Multidisciplinary assessments, psychological, medical, psychiatric, educational, even vocational assessments, recreational. We want to know everything there is about this kid. We want to do the absolute best we can do to help take that knowledge and plan a map of recovery, not just for the adolescent, but for the entire family. Family systems get sick together. Family systems get well together. As the adult child of an alcoholic, I know that. And I know that in my own family, all of us, in little doses, got really used to a very abnormal situation. And had we treated just one person in the family and sent them back into a family system that was used to that abnormal situation, it wouldn't have worked. If there's a problem, it's not going to get better on its own. This is a progressive illness. It gets worse. And the consequences get worse as well. So doing nothing is not an option. Bradford has never turned its back on its commitment to treat adolescents. We love kids. We love nothing more than sober kids. And so Bradford's commitment going forward will be to always have kids in our treatment programs.